So the first part of your resuscitation, we think about the initial approach. Now this is going to be some big picture questions about the scene and the logistics that are going to go into managing a cardiac arrest, and it's also just making sure we've got the basics all squared away. So for starters, I've got all the equipment that I need: a defibrillator, a response kit, oxygen suction. I've got PPE, so I'm wearing gloves, might be wearing some glasses, things like uniform, having a radio is all part of our scene setup. It's a good opportunity to have a talk to your crew partner, so establish who's going to be going into which position initially. My personal preference is I'm always going to go to the head, so I'll be talking to my crew partner about, hey, if it is a cardiac arrest, I'll start you on the chest compressions while I get some information and set up the scene. In terms of scene-specific things, yes, we want to know that it's safe. We don't need to go quite into as much depth as you would have done in IPP, but in a basic sense, there's no hazards. We've got room around the patient to run an effective resuscitation. We don't need to move them off the bed or into a larger area. We want to have a little think about the dispatch notes that relate to the patient's clinical condition to help us move towards either a primary cardiac arrest or a secondary cardiac arrest style management. For example, if this was an older person who had a sudden loss of consciousness, that sounds like it might be more primary in nature, whereas if there were some other circumstances such as drowning, hanging, choking, there might be an indication that there's a secondary cause, and that will help us decide, is this a primary problem or a secondary problem, and guide our initial actions. When we approach the scene, I'm going to be carrying the monitor and the response kit because it's what I'll be using initially. So I'm going to go to the patient's head and from the beginning set up my equipment in a nice ring around the patient's head. My crew partner is going to bring in the suction and the oxygen, and they're going to just lay it down by my side so I've got access to it when I need it. We need to decide if this patient is in cardiac arrest or not, so we're doing a combination of visual features such as their overall perfusion status, any apparent respiratory effort or absence of it, and we need to do a painful stimulus to see if there's any response. If there's none of those things, we're going to be starting our resuscitation. So my crew partner will go ahead and begin their chest compressions while I set up my initial string of actions and get ready to run the resus.